So I have had collaborations with teams in Gambia and other parts of West Africa for a few years, in fact since I began my research career. I was aware of the issues around hepatitis B and liver cancer in West Africa, the enormity of the problem. And it came to a point where people have been collecting data on these patients with hepatitis B for many years and looking at disease progression, but not doing anything about it. That's not quite true, actually. There's vaccination programs, and the first vaccination program for hepatitis B began in the Gambia. But people who missed that vaccination program and got infected, nothing was happening to them. And there was an opportunity through the European Commission to raise some funding to run a pilot program to look at screening and treatment of patients with hepatitis B and see if we could set up some treatment that would prevent people moving on from chronic hepatitis to cirrhosis and cancer. And I just seized the opportunity, and Prolifica started from that.
On my own part, I think the interest in how I got involved in the European Union project, which Mark is leading, was basically because of my desire to change the practice of medicine in Africa. Particularly, I realized that there's need to bridge the gap in technological advancement between the West and our own African states. And so I first of all started to develop collaborations, and it was one of those trips that got me involved with Mark. I didn't think that it was going to evolve into what is currently ongoing, but my interest in liver cancer became much more aggressive when I saw a 23-year-old girl and another time a 17-year-old boy who died from malignant disease of the liver. And so when this project came through, it was a bright opportunity to develop skills of West Africans, and I got involved and I was kindly offered the opportunity to walk along and develop this project.
Of course, we've known about hepatitis B since the mid-1960s, and there have been some efforts to deal with the infection worldwide. So the vaccine program was an obvious one. But one has to think that WHO and other, public health authorities globally have said, okay, vaccine program, that's it. And of course we now know that's not it. There is more to be done. Unfortunately, when the Millennium Development Goals were launched, obviously the year 2000, they named 3 diseases as being major infectious diseases, so HIV, TB, and malaria. Now, of course, they are important diseases, but it ignores the fact that the magnitude of the hepatitis problem is just the same. And for some reason, it was ignored. So public health authorities probably felt the solution was already there. There's another problem, that actually hepatitis is stigmatized because in Western textbooks it says, oh yes, hepatitis, that's sexual transmission or intravenous drug use. Actually, the natural history of these infections is neither of those. Kids pick up hepatitis B in early childhood, either from their mother, if their mother's infected, or from siblings or playmates when they're very young, because this virus is 100 times more infectious than HIV. And it's easily passed on from, if you've got a little cut or a graze, there's so much virus in every mil of blood, it's easily transferred. So, this is an opportunity now through Prolifica to increase awareness, not just in West Africa and potential patients, but also amongst the politicians and public health authorities.
Some of the challenges would evolve around transfer of samples, particularly for some of the sites that have never been involved in a lot of research projects. For instance, in one of the sites in Nigeria, some of the samples that were transferred over to Imperial College arrived damaged, and we've had to send someone over to Nigeria to accompany the samples before it could pass through customs. So that was one challenge. Some of the challenges also would revolve around the work nature of most of the people on ground. Good enough, we've got a lot of those who are supervising those local scientists have had some exposure in the United Kingdom, and so they're able to transfer some work ethics, and that's one issue that Mark had raised. And so a lot of that is changing, and a lot more people are seeing the fact that you've got to work hard in order to deliver results. But by and large, we've been able to get around these problems, and indeed, as you may get to hear if there's time enough, some of the research of the samples that came over to the United Kingdom are actually producing very good results, and which might interest you.
One of the issues that we come across is that many of the people working on Prolifica are white and Middle Asian, look like me, and I'm looking kind of foreign in a West African setting. But of course the Amos bursary guys, they look like, I mean they're westernized, but they look like the people that they're moving among. So the population that we're going out to screen see somebody who looks like them, feels familiar, and they break down some of the barriers that there are between people like me and West African individuals. Then they bring in some different skills. You know, I'm a bit, old and set in my ways. I'm an academic clinician, but they're bringing different skills to this. They're bringing a fresh mind to the situation. Jalade, he's out there doing some filming that helps us, with the publicity aspects. So it's it's very refreshing perspective that they bring to the project, as well as bridging some of the gaps with the local population. Success for Prolifica would be, we can show at the end of the day that a simple point of care test will identify a patient, that we can transfer Western technologies into African clinical settings, and that we can deliver medications for hepatitis B, and that has an impact on the disease burden. That and just in a small pilot project, that will be a success.